Hello everybody and welcome. My name is Josie Thurmond and I am a first year student in the DNP F&P program. Today I'll be talking with you about healthcare costs and value. First, I'll be reviewing the evidence about healthcare costs with you, and then I'll be sharing my own personal opinion about how I believe the US should be spending its healthcare dollar. We'll be starting out this presentation with a little game based on a Harvard study that looked at US healthcare costs compared to other countries. A statement will pop up on the screen, and then you should say to yourself whether you believe that is true or false. In 2016, the US spent nearly twice as much on healthcare as other high-income countries. True or false? That is true. The US spent 18% of its gross domestic product on healthcare costs, while other nations only ranged from 4.9% to 12.4%. Well, then you may be thinking, the US uses more healthcare services than peer countries, thus leading to higher costs. No, that is actually false. The US has lower rates of physician visits and fewer days spent in the hospital than other nations. Okay, but maybe high spending on healthcare in the US has resulted in longer life expectancies. No, false again. The life expectancy in the US was actually the lowest of the 11 countries at 78.8 years. The range for the other countries was 80.7 to 83.9 years. So you may be wondering, well, where is our money going? 8% of healthcare costs are going to administration in the US, whereas only 1 to 3% are going to administration in other countries. This is largely in part to our privatized system. We have to pay private insurance companies to be our middleman, and so that's where that money's going. We spend $1,143 per capita on pharmaceuticals, whereas other countries are only spending $466 to $939, and again, that's partially due to our privatized system. In other countries with universal health care, the government controls the price of medication and medical services through negotiation and regulation, but here we don't have that type of regulation, and so it's more of a competitive system, and we end up paying twice as much, if not more, on the same drugs as other countries. Lastly, the physician salary in the US for the general practice doctor is $217,173, which is significantly more than other countries who are paying about $86,000 to $154,000. So as you can see, there are some big problems in our current healthcare spending. It's not the most efficient, and that's why I've created a new budget with the primary goal of keeping people healthy. It is based off of this right here. This shows our actual spending on healthcare in 2016. I've adapted my own model from this. We'll just let that go away since it didn't work out the best. I have 32% of healthcare costs going to hospital care. That is the same as the spending before. The US actually spends less money on inpatient care than other countries, so I didn't want to decrease that at all. Instead, I increased the next category, government administration and net cost of health insurance. I increased that from 8% to 18%. The US does not have a universal healthcare system, but this would allow enough money to do so. Next, I spent 13% on physician and clinical services. That is down from 20%. As we just talked about, we spend significantly more on our physicians than other countries, but that is not being reflected in our outcomes. And in our pharmaceutical companies, I have decreased our spending from 10% to 5%. I believe with a universal healthcare system that we will be able to regulate pharmaceuticals and spend significantly less, and 5% should be good for that. That is about on par with other countries. Then we have 5% for nursing care facilities. That is the same. Dental services is the same. Investment, I've only decreased from 5% to 4% to invest less in machines such as CT scans, MRI machines, those type of investments, just to make more room for health promotion and prevention activities. Other professional services, that little gray section is the same at 3%. The other category, which is 16%, has been modified only in the public health activities subcategory. I increased that from 2 to 4% to focus more on health promotion and prevention. And the other subcategories are the same: medical equipment, and then home health care, as well as other health, residential, and personal care. Overall, this is a step towards universal health care. There are several benefits, including that it alleviates the healthcare burden on the economy. It is a more efficient system, it lowers administration costs, and it reduces the number of the uninsured. Even though the US spends twice as much on healthcare as other countries, we have 8.6% of Americans who are uninsured, and as such, they are less likely to access preventative care or participate in health promotion activities. And those are the care and activities that are preventing or managing chronic diseases. And chronic diseases actually take up about 85% of our current healthcare costs. And so by preventing those in the first place, we are being proactive about our healthcare spending. There are a few caveats to universal healthcare spending. Ultimately, healthy people pay for sick people. Currently, the sickest 5% of the population consume about 50% of total healthcare costs. There are longer wait times to see a specialist, and there are longer wait times for elective procedures. Finally, there's lower pay for physicians, as we talked about. But when you compare the benefits and the negatives of universal healthcare, I believe it's ultimately a step in the right direction for us. If you look at this image from a World Health Organization report, the US ranks only 37th out of all the other nations they took a look at, and overall that's showing our efficiency in our healthcare spending. One of the main differences between the countries above us is that they have a universal healthcare system, and so that's just one more reason I believe that we should adopt this system. Other people are doing it, and it is more efficient for them. For the amount of money that we are spending on healthcare, we want it to be efficient. I would like to take this one step further and propose, what if we had a healthcare system based off of that of Canada's? I believe Canada has a lot to offer, even more than its maple syrup and hockey. They have a single-payer healthcare system in which the government pays for services through a private delivery system. Now, this is the primary reason why it shows Canada's system as a model, because we already have so many private insurance companies. We can convert them to this system for a seamless transition. The government pays for 70% of healthcare costs, and private supplemental insurance pays for vision, dental, and prescriptions. Physicians are reimbursed at a fee-for-service rate, in contrast to a value-based system. And I prefer that because physicians and healthcare systems, even with the best of intentions, sometimes have patients who don't adhere to their healthcare regimens and or have healthcare outcomes that are poor due to other factors. And so I'd like to keep it at the fee-for-service rate, and then the government would negotiate both prices for prescriptions. I also like Canada's plan because it is not a mandated plan. There are several countries who were ranked above Canada on the WHO list, but they had mandated plans, and it seems like for the US, having a mandated healthcare system carries negative connotations. So I want a healthcare system that people are receptive to, because if they're not receptive to it, I'm afraid that they're not going to use it. And so this would take care of that. I would like to leave you with 3 summarizing points. First, that our current system for managing money in healthcare is inefficient. We are spending so much money on healthcare, and it could be spent so much better. Secondly, I would like to shift to a preventative model that focuses on health promotion and prevention to decrease the amount of spending on chronic diseases. Lastly, I believe a transition to universal healthcare will allow the US to spend money more efficiently and ultimately provide better healthcare for its citizens. Thank you for joining me during this presentation. If you have any questions or comments, please feel free to reach out to me. I look forward to hearing from you and taking a look at your reviews. Thanks.